Hi there, my name is Dr. Olivia Viney. I'm a veterinarian here at DePore Veterinary Hospital, and I'm one of the vets here that does surgery. And today we are going to talk about kitty cat dental care. Cat dental care is important because they have teeth, just like us, and they can't brush their own teeth. So they can get a lot of the same disease processes that people can, and so it's important that we inspect their teeth yearly and see if there's any signs of discomfort or any disease that needs to be addressed. The most common sign of kitty cat dental disease is actually no sign at all. Dogs and cats are notoriously stoic and very tough when it comes to any signs of discomfort for dental disease. Unfortunately, they don't tell us when there's discomfort. Some signs that you might see if disease is becoming really advanced is significantly bad breath, dropping food while they're eating, excessive drooling, potentially swelling of the face if there's like a tooth root abscess or something like that. But unfortunately, if we're seeing those signs, then the cat has probably been in significant dental pain for quite some time. There are a few common diseases that we see in cats as their disease progresses. The most common that we see is plaque that has hardened into tartar on the teeth. So that's any kind of like brown discoloration or anything that you see on the tooth. That can progress while it's there. It can cause inflammation of the gum, which then progresses into periodontal disease, which is affecting the gum, the attachments of the tooth, and it can also result in some bone loss of the tooth. So if we see a tooth that's mobile or wiggly, then we know that there's periodontal disease in that area and there's been some inflammation there for quite some time. Something else that we see really commonly in kitty cats is what we call resorptive lesions of the teeth. So it's something that's more specific to cats. It's estimated about 50% of cats have them, so it is very common. And what happens is that the body starts to resorb or start to get rid of the tooth, like the actual hard crown part of the tooth can be one way that it happens. And that disease process is painful, but again, the cats won't tell us, even if it is painful. So the body starts to degrade the tooth, and then the body says, uh-oh, there's a big hole here in this tooth. So it lays down a bright pink, fleshy, sensitive tissue in that area. So if we see those on exam, we can say that's probably a resorptive lesion. That tooth is very diseased and really needs to be extracted or treated to ensure comfort for that patient. One thing that cats don't get are cavities. They are not reported to ever have cavities. They're rare in dogs and not reported in cats. Another thing that we can see periodically in cats is some kind of abscess on the side of their face. Usually you'll see swelling. All of a sudden you wake up and half of your kitty's face is swollen, usually from a tooth root abscess from periodontal disease that's been brewing for quite some time. And sometimes we can see fractures of teeth as well, most commonly the long fang-like canine teeth in the front. And if that is what we call complicated or enamel dentin fracture, meaning that the pulp or the inside part of the tooth is exposed, then that tooth either needs to have a root canal or it really needs to be extracted to prevent problems in the future. The risks with not treating these diseases is potentially undetected pain, because like we said, cats don't really tell us when they're in pain, and so your cat may have dental pain that is unknown to you, and so that's really the risk of not treating them or at least having the vet examine and see if they see any signs of discomfort. So as humans, we're supposed to go to the dentist twice a year, every 6 months. And we do basically the same process here during what we call a COHAT, or a complete oral health assessment and treatment that we do on dogs and cats. And that entails the pet being put under anesthesia. If you have apprehension about your pet going under anesthesia, please talk to your veterinarian about it, and we can explain the safety of the situation and possible risks, and what we do to mitigate any potential anesthetic complications. Other things that we do during COHATs are full mouth dental x-rays, because we can see the crown or the visual part of the tooth in the mouth, but it's really important that we look at the root also in kitty cats because of those resorptive lesions. We will scale and polish the teeth to make sure that there's no tartar left on the teeth. We do a dental examination, so we probe around each tooth to find any significant pocketing or gingival recession. And then if indicated or if medically necessary, we will do extractions if needed, if the tooth is diseased beyond something that can be repaired or saved or reversed. Some milder grades of dental disease can be reversed with professional cleaning and scaling, but if it's progressed too far or there's too much bone loss or there's too much of a fracture, then unfortunately those teeth are best extracted and out of the mouth so that they don't cause any discomfort. There are things you can do at home to help your cat's dental health as well. There is a website that I like to reference called the Veterinary Oral Health Council, or vohc.org. There's a list of feline-friendly dental products, and this list has been tested to prove that they are actually effective and they do what they're supposed to do. This list includes diets that are specific for dental disease or prevention of dental disease and plaque and tartar. It also includes edible chew treats, water additives, things that can be added to the food, and so it gives a nice list of things that owners can explore to see what their cat might be amenable to. The best thing that can be done at home to prevent dental disease is brushing your cat's teeth, which I know sounds crazy, and most people say that's impossible because it's a cat. It is possible. It takes some patience, it takes some training on the cat's end, and it doesn't need to be done every day or for 2 minutes every day. I usually tell people 30 seconds 3 times a week is enough to make a difference and help prevent disease in cats. Even if you are the most diligent toothbrusher, your cat will probably still benefit from a professional cohat in their lifetime. The gold standard is recommended yearly, but if you can do some dental care, we may be able to extend that as well at home. Because cats don't get cavities when you're brushing their teeth, you can include some of their favorite snacks as motivation. We have small toothbrushes here that can fit in a cat's mouth better. There's also fingertip toothbrushes that can be a little bit softer in a cat's mouth. We do recommend using smaller things that fit better, and veterinary specific toothpaste as well, because human toothpaste is not meant to be swallowed, and kitty cats don't know that, so we do recommend a veterinary specific enzymatic toothpaste. If you have any questions about cat dental care, what is involved in a dental procedure done here at DePort, or any other questions, please feel free to contact us, and we're happy to help anytime.